Hello, you've tuned into The Wire. Today is the 12th of April and this is the daily coronavirus updates bulletin. Over 8,447 people have been infected with the novel coronavirus in India so far, of which 764 people have recovered and 274 have died. On Sunday morning, Gujarat reported that 25 people have died in the state. Nagpur witnessed a huge jump in coronavirus positive cases on Sunday, with as many as 14 people contracting the virus within 24 hours. Maharashtra has recorded the highest number of deaths. 127 people have died in the state so far. The nationwide lockdown in India looks likely to be extended by 2 more weeks till April end after a consensus emerged among states on Saturday. The Prime Minister held a video conference with chief ministers to discuss the same, and states concurred that the lockdown should be extended. Odisha, Punjab and Maharashtra have already extended their statewide lockdowns. Globally, over 16 lakh confirmed cases were reported today and the death toll of over 1 lakh. The United States has become the world's first country to have registered more than 2,000 COVID deaths in a single day. The number of infections in America has crossed over 5 lakh, the highest in the world. On Sunday, Russia reported that 2,186 new coronavirus cases emerged in the country. This is the largest daily increase in the country since the outbreak. Over 15,000 people in Russia now have the virus. Gurgaon, Faridabad, Nuh and Palwal are the districts in Haryana which have recorded the highest number of COVID-19 cases. These districts will be treated as red zone areas or hotspots in the coming days. This was confirmed by the Chief Minister of the state. He also said that 18 districts will be divided into vulnerable areas or orange zones where cases are fewer. The areas in the red zone will not be able to run economic activities at the moment. In a letter addressed to Assam's Health Minister Himanta Biswa Sarma by 12 members of Assam's Foreigners Tribunal offering a donation of Rs 60,000 for COVID-19 relief work, has allegedly made a reference that their help may not be extended to members of the Tablighi Jamaat. Allegedly, the letter calls out the member of Tablighi Jamaat as Jahil and Jihadi. Jamser Ali, an activist of the Citizen of Justice for Peace, told The Wire that the letter is factual and he has cross-checked the names as mentioned in the letter. He said that the letter was vicious and was written by someone with a poisonous mindset. The letter is dated April 7th and is signed by Kamlesh Kumar Gupta, a member of the Foreigners Tribunal in Buxa district. When Gupta was contacted by the Sunday Express, he said that he had written the letter but said that he had withdrawn it and that it was not sent to the government. On the contents, he said that whatever is there in the letter, he does not wish to discuss it further. In an order dated April 8, the Ministry of Health and Family Welfare has urged the chief secretaries of all states to organize and ensure that ENT specialists, residents and post-graduation trainees should be utilized to collect COVID-19 samples. The order says that there is an urgent need of trained and qualified personnel to collect samples as the number of infections in the country continue to increase. 3 days after the Supreme Court ordered free COVID testing by private labs across India, a Delhi-based doctor has requested the Supreme Court to modify its April 8 order and restrict free testing to economically weaker sections only. In his application filed on Saturday, the doctor said that free COVID-19 testing order to private labs will disincentivize them from working. He added that when the country wants to ramp up testing, private labs will feel the burden and there is a real risk that they will stop testing. On the 8th of April, the Supreme Court had ordered the centre to ensure all tests were conducted free of cost, both by government and private laboratories. When India reported country's first coronavirus case on the 30th of January in Kerala, far across in Ladakh, senior officials met to assess the preparations to combat the infectious disease. This was because hundreds of people on an annual pilgrimage to Iran, one of the worst affected countries, were scheduled to return in the next few weeks. After a detailed meeting, the administration ordered screening of every person entering Ladakh. On the 28th of February, the first COVID-19 case in Ladakh showed symptoms. By the 6th of March, after his reports were in, he was confirmed positive. The administration had already isolated his entire family and sealed the village by then. In the next few days, the number of cases crossed double-digit, which led to panic in the region with limited healthcare facilities. But within a month, the region turned the tide in its favor in the battle against the coronavirus. In the last 21 days, only one person has tested positive for COVID-19 in Ladakh. Of the total 14 patients, 10 have tested negative and have been shifted to the hospital, while 4 others are on their path to recovery. Medics say that this can be attributed to aggressive testing, mass contact tracing, use of social media to spread awareness, and an early lockdown of hotspot areas, much of what we saw in Bhilwara. This has helped the administration in Ladakh to put the lid on the disease. To learn more about this story, log on to thewire.in. We will see you tomorrow. Until then, stay safe.